diet or dieting during Ramadan. You know how important the holy month of Ramadan is. And to that extent, we've elected to bring this topic just so that you're able to know how to organize yourself if you're diabetic. And to discuss this with us are DJ Sule Kabara, private consultant, dietitian. DJ, you're welcome.
Thank you very much, Mr.
We equally have Professor of Medicine, BUK, consultant endocrinologist, Aminu Kano Teaching Hospital, past National Vice President, Diabetes Association of Nigeria, and that is Professor Andrew Uloko. Prof, you're welcome.
Thank you very much, Mr. Joe.
Okay, we want to set the ball rolling. You are endocrinologist, then you are a dietitian. So, Prof, I want to ask, how do you collaborate in order to be able to handle one who is diabetic, just so that that person would know how to manage himself, take care of himself, particularly during Ramadan season?
Thank you very much, Mr. Joe. It's a very important question. Let me start by saying that diabetes mellitus, as we call it, a chronic condition of sustained elevation in blood glucose, is a condition that is quite very common now, affecting nearly 463 million people across the world and affecting about 19 million people in Africa, with roughly 6% of Nigerians, approximately 12 million people currently living with diabetes mellitus. In the management of diabetes is incomplete without a recourse to dietary issues in the management. It's like you don't talk about the care of persons living with diabetes without first addressing diet or nutrition. And nutrition, as you know, some people say you are what you eat. It has a long way to go in our health, generally speaking. It determines our health. It helps in disease prevention, even in diabetes prevention. And even when the disease becomes apparent, it's diagnosed. It has very important roles to play in the care of the individual. So no matter how fantastic the medication will be, if you do not address the right diet or nutritional approach to the care of the individual with a chronic ailment like diabetes mellitus, you never succeed in giving the patient the best that you can in terms of the care and outcome. So it's not surprising, therefore, that we have worked with Hajia DJ Kabara for so many years. I think we've worked with her now for close to 2 decades or more.
Wow.
Taking care of people living with diabetes, which is one of her pet projects. I know she is a nutritionist, dietitian. Takes care of nutritional needs of patients generally. But in the aspects of diabetes, which is her passion, she's done excellently well, and we collaborate very closely in providing this service to most of our patients.
Okay, as a build-up to this particular topic, I'd want to know from you, Prof, do we have types of diabetes?
Yes, there are types of diabetes. In the past, we talked about 4 different types of diabetes, but quite recently, as recent as the past 2 years, World Health Organization has broadened it to 6 different types of diabetes. I'm not going to be bothering you with all the details, but let's focus on the most common forms of diabetes in practice.
Okay.
And so you talk about type 1 diabetes accounting for just about 5 to 10% of cases, and type 1 diabetes is seen in children, adolescents, young adults, not so commonly in adults. And then you have type 2 diabetes, which is by far the most common form of diabetes that we see in practice, accounting for some 90 to 95% of cases. And this type of diabetes is the one that escapes diagnosis very easily because it can present in very subtle manner. It may go on for several months or years without recognition that there is a problem. Okay, and then by the time it is presenting, sometimes it comes with problems or complications, as we call them. And then there is also the type of diabetes that affects women, what we call diabetes in pregnancy or pregnancy-related diabetes. Some part of it is gestational diabetes. The woman is hale and hearty until she gets pregnant, and then the changes in pregnancy, the hormonal changes, makes her to be at increased risk of developing diabetes, and it is discovered and apparent. And then there is the type we call the other specific types, which if you are able to find a specific cause to it, maybe somebody was taking the wrong drug for some other illness for too long, or there is a form of genetic disease in the family that runs in the family, you could have what we call other specific types of diabetes. I'll leave it at that, but I want us to just focus our energy on the two common types of diabetes. Type 2 diabetes, which I say accounts for about 90 to 95% of cases, and type 1 diabetes, which is commonly seen in children, accounting for about 5 to 10% of cases.
Okay. I will not let you go without explaining this to us. Most times we see and we hear from you specialists, pancreas, insulin. Can you break this down for us?
Okay, just think about the key to your house and the door to which the key opens before you go in. So remember these three things: the key, the door, and yourself that has to go into the house. Just remember these three things. Now, in the context of insulins, pancreas, diabetes, blood glucose, the key is insulin, which is a specialized chemical substance produced by a part of the human body called the pancreas. So the pancreas produces insulin, and insulin is the key, which unlocks the door to the cell. And if it unlocks the door to the cell, it means glucose can enter into the cells to produce energy. So if the key is not present to open the door, glucose will not go into the cells. Situations, let's bring it home to diabetes. Situations in which the key will be absent or near absent is found in people with type 1 diabetes that have absolute or near absolute lack of insulin, right? And then think about the door that has refused to recognize the key. Okay, it's your house, you are used to this key, you are used to this door. All of a sudden you come to open the door and the door just refuses to recognize the key. It means the door is resistant to the key. And so you say, in the context of diabetes, people with type 2 diabetes have this type of problem where the cell, the door of the cell, is resistant to insulin. So you see there is predominantly insulin resistance in people with type 2 diabetes. Whichever way, be it that the key is not adequate to open all the doors, or the door is not recognizing the key, whatever it is, glucose is not entering the cells enough for energy production. And if glucose do not enter the cells for energy production, then you can begin to work out what symptoms or signs that can result in. For instance, there is no energy, so you feel weak. It's body weakness. there is no energy. The usual mechanism by which the body works is distorted. So you begin to have problems like boils. You are prone to infections of all sorts. There is no glucose in the cells. It accumulates in blood. And so if I test your blood, I will see blood glucose levels very high. And because glucose are accumulated in blood, you are likely to have excessive passage of urine, because the presence of glucose in blood is going to draw water from all your body stores into the blood. And then that blood with high content of glucose is passed to the kidneys, where you will begin to urinate excessively. If you urinate excessively, it means you are going to be thirsty because you are losing body water. So excessive thirst, excessive urination, body weakness, fatigue, weight loss, these are cardinal symptoms of diabetes mellitus. I don't know if my explanation has helped.
You have driven it home. Yes, but there's one thing you mentioned, just so that people could understand this. You said it gets to a point where there's this frequent passing of urine.
Yes.
Now, is it only diabetes that could present that kind of condition? Situation where one is passing urine?
The straightforward answer is no. It is not only diabetes, but of all the causes of excessive urination, the most common is diabetes mellitus. And so what type of excessive passage of urine are we talking about? It is increase in frequency and volume of urine, as it is different from increased frequency of urine but not in volume, as you see in some other condition like urinary tract infection, for example. There are situations by which even temperature changes in the environment. You recall that during the cold weathers, you wake up to urinate more than during the hot season. It's because the body is conserving water, and the temperature in the environment is allowing you to adjust your body water depending on what is available. If the temperature of the environment is very hot, your body conserves water. If it is cold, your body gives out the excess water that is not meant to be stored. There are other conditions that I don't want to be using the big medical terms on television.
We are glad that you know you're communicating with.
So those things like diabetes insipidus, electrolyte problems, calcium balance that is not adequate, and so on. But it's not for this audience, really.
Thank you very much, Prof.
Thank you.
That is why I like you, because you know we are the lay men, and so you break down the language, because if you begin to use your terminologies, we won't know where you are anymore. Thank you so much. Now let's move on to DJ Sule Kabara, private consultant, dietitian. Now, the Ramadan period has come. We need to prepare meals. And we have the one called Sahur. We have Iftar. Can you tell us how we are supposed to handle this situation if we are diabetic? When you talk about Sahur, you talk about Iftar, preparation of our meals, the kind of meals we need to take within this period, this holy month of Ramadan.
Okay, thank you, Mr. Ju. So before I even talk about the iftar and the suhoor, it's good we understand the food itself. Like all diabetic persons, they are being advised on the portion control of what they should eat. Because what I will be advised on to take, that's the quantity of the food. Due to my age, due to my sex, due to my level of activity, and due to what my condition is. Like I'm a type 2 diabetic, will be different from if to say you are diabetic, or if the professor is a diabetic person, because we'll assess the nutrition status of that individual or that patient in terms of their weight, in relation to their age, and then their kind of activity. And then when it comes to food, we do not just prescribe, we dialogue, we talk with the patient to find out or to assess what that patient can actually afford in terms of food, what the food pattern of that person is, what the food habits of that individual is that's diabetic, and what they can afford, whether the person is living at home or the person is living outside the house where they cannot get home prepared meals. So that will have to be taken care of. And then for the diabetic meal in general, they are being advised to take foods that yield energy, the carbohydrate foods, but in forms of complex carbohydrates. That's the carbohydrate that will take time before it is being digested and released into the blood in form of glucose. And then the protein intake, no matter what the condition of the individuals, should be small intake of protein. Now for the carbohydrate complex, it should be moderate intake. And then for the protein, small intake. For the fat intake, fat, we require fat, but it should be small. And then all simple sugars and processed foods should be avoided as much as possible. So based on this, the diabetic patient is advised on what to eat. Like what I will sit down and the advice that will be given to me on my portion size, that's the quantity that I should take. It will be different from somebody else. Whether I'm taking medications, whether I'm just on diet control, whether I'm taking insulin, that's the injection, or both insulin and my oral hypoglycemic agent. So that will take care, that will have to be taken care of. And then another thing, again, when it comes to diet, there are things that are being advised to, that all diabetic patients to be taken liberally according to what they can afford, what they have, and then what they can access all the time. That is leafy vegetables and non-energy giving vegetables. All forms of leaves, those that can be eaten raw, those that can be eaten cooked, and then these vegetables, non-energy, all the vegetables that we use in making salads, the garden egg, the carrots, the tomatoes, cucumber, all these ones, they are being advised that the diabetic patient should take a lot of them, because the food that will satisfy relieve hunger, we say you should take in moderation. That's the carbohydrate foods. So if you take that in moderation, actually you will not be full. So what will make the person to be full is this non-energy giving vegetables. And the idea of taking these non-energy giving vegetables is that they do not increase the energy content of the meals that we are taking, but they will fill the stomach. And then in the process of the body converting that non-energy vegetables to get what the body requires in terms of vitamins, minerals, and then the fiber, the body is using energy too. Before it is being digested, the chewing process, the digestion process, all these processes, the body requires energy. So in a way, the body is using the stored energy it has, or the energy it already has, or the energy from the food that's been eaten, to convert those non-energy foods into what the body can make use of, and then what the body doesn't require will be passed out. So we take moderate, we take a large amount, we take small amount, we take minimal amount. So that is generally the advice that is being given. And then based on this, when we fast, like when we come to break our fast, that's the iftar. By that time, our water and glucose level has gone down. Almost all our systems are resting.
Because you have gone away from what you used to do, like
for quite
taking
some
water
hours,
consistently.
Nothing goes in from the mouth. So all the digestive processes, all the system, they are at rest. They are not working. So you need to eat something that is friendly to the system, so that it will not overwhelm the system, so that you not make it to suffer. Let them start to function gradually before they come full on board to function properly as a digestive system. So you need something that is soft, something that can yield energy readily, not like when you take sugar, but something that will give you the sugar that the body requires in a gentle way, so that by the time you know what you are into, at least the fruit you've taken or whatever you've taken will rise up the sugar gradually into the blood, so that at least there will be some level of sugar in the blood. So what the person with diabetes is advised to take at iftar, that's the breaking of the fast, is they should drink water, but not pay for the thirst that you have suffered during the period of fasting. That is taking large quantity of water. They shouldn't take large quantity of water. They should take just sips of water, and not very cold water, just sips of water. After taking that water, then they can eat their food, the portion that has been advised for them to take. They will take the food, and it's good they take the food that doesn't have too much acid in it, because the stomach is empty. Taking too much acid might cause some certain upheavals in the digestive tract. So things like watermelon, like pawpaw, apple, they are very good. Mango, they are very good. If there are guavas, they are good because they do not contain a lot of acid. All acidic food should be avoided at that time. So after taking their allowed fruit, they are allowed to let them to, even if it is date, they can take their date. But the dates too, they are allowed date. We advise for diabetics not to take more than 3 dry dates because they are very concentrated with sugar. And then if it is the fresh one that doesn't contain too much sugar in it because of the fiber, because it has not ripened, they can take up to 5. And then let them take it along with water. When they've taken that, then they can take something else. Any food that is being allowed, they can take something small. After taking that food, let them rest, their sugar level will come up, their strength will come back somehow, and then they'll go and offer their Maghrib prayer. After the prayer, when they come back, that's when they will sit and eat the meal that will make them to be full or satisfied. And then the food too shouldn't be too oily. Shouldn't be too oily. And the meat portion too should be highly controlled. Depending on what that patient has been advised to be taking before Ramadan, it should be applied even during the Ramadan period. So the meat portion, please, should be highly controlled. If it's the pieces of meat, you allow for about 2 pieces of meat. If it's chicken, a segment of the chicken, like the leg or the thigh, should be divided into 2, just 1 cut.
Wow.
Not all. And then if it is egg, 1, but the egg too, we try to minimize the egg to about 4 eggs in about 7 days. And not 2 to be taken at a time. So even fish, it should be cut. So those who go for pepper soup, they should take care of what they eat. Please, the quantity, the portion. And then, as I said, the food meal should be well cooked. It should be soft, because if it is harsh and not very cooked, well cooked, the tendency is that the body will require a lot of energy to digest that food, and the water too will be drawn. A lot of water will be needed again to make that food to be useful to the body, and then what the body doesn't require to be passed out. So if you take the food that is not well cooked, or it is too oily or highly spiced, it means that you will be taking a lot of water, because taking too much protein too generates a lot of heat in the body. So a lot of water will be required, and then during that period, fasting period, we try to conserve as much fluid as possible within the body, not to make the body to pass out or to pull out and pass it out from the body. So that is how the food should be eaten. If it is leaves or vegetables, they should be well prepared and well cooked too, so that they are soft and easy for the body to make use of. So after that, the meal, then they will go again for their Isha prayer, and then for their Asham if they can. When they come back, they will rest, and then they will take their snacks. Because before fasting, they are being advised to take their breakfast, their lunch, and then their dinner. No skipping of meals. And then between breakfast and lunch, they are advised to take something so that they do not stay with hunger. Because if they stay with hunger, the tendency is that the next meal they will eat a large amount of food, which is not advisable. But if they take in between snacks, they will stay full, not hungry, and then when the time for the next meal comes, when they eat that moderate portion of the meal, they will be okay. So the same thing during the Ramadan period. After they've eaten, when they come back, they will have a snack. Continue to be taking sips of water, gradual, up to the time they will go to bed. And then when they wake up for the sahur, they should take the meal that they've been advised to take to, like similar to the meal that they've eaten after they've broken their fast. And then it is good to close their mouth for sahur with a fruit. Any form of fruit, not too acidic too. And then the meals too, they should follow the same pattern as the meals that they've taken. Low protein, low fat, no spices in the meals, and then the food should be well cooked.
It's okay. Thank you so much, DJ Kabara. Now, I am not going away from you yet because there's still much to talk about. Now, those people who are diabetic, isn't there a way we could advise them, especially if theirs is a very serious one, not to participate in the fast?
Ramadan, as we all know, is a religious event. It's a yearly event. All Muslims would want to partake in that period because it's something that comes once a year. Nobody knows whether you can get to the next year to be able to fast. But before somebody that is diabetic or a diabetic person or somebody living with diabetes fasts, they should have assessed themselves. At least 2 months prior to this fasting period, their sugar level had been well under control. No ups, no downs, that is no hyperglycemia, no hypoglycemia, that is not too much sugar rise, and then not too low sugar. They have not had any of such sessions during the period, at least 2 months back. And then they do not have any underlying illnesses that will compound maybe on their diabetes or their status. And then they've partaken in the fastings before then, like the Mondays and the Thursdays, they've tried to fast. And then after the fasting, there hadn't been any problem, no complication whatsoever. They are quite okay. And then with all this, they should have been assessed by their doctors or their practitioners that see them to assess that they are in a condition that they can fast, because their drugs have to be adjusted. Whether they are on their oral hypoglycemic, that is what they take, the drugs they take, whether they are on injectables or they are both, they should have been assessed and checked so that their medications will be adjusted due to the changes in the feeding pattern during the Ramadan period. So they should go through all this before they undertake to do the fasting.
Okay, let me move on to Professor Uloko now. But just before we do that, it is important you know that this is Health Hour reaching you on Rama Television. And when we come back after this break, we'll continue with the program. Please stay with us. Yes, Prof. I know in passing you mentioned it, but I want you to clarify us very well on what we could look out as risk factors of diabetes.
Okay, thank you very much. When you talk about risk factors for diabetes, there are those risk factors that we know quite commonly. The fact that it can run in families. So family history of diabetes, for example, in your siblings or in parents, confers increased risk. Advancing age. The older you get, the more the risk for diabetes, particularly if you have a genetic predisposition or a family history to developing diabetes. Unhealthy diet And when we talk about unhealthy diet, Haja Didi made mention of some of them. You eat energy-dense, high-caloric, fatty foods virtually all the time. That's unhealthy diet. The type of food we call fast foods. They say if you eat fast, you die fast. Okay?
Wouldn't be the one you call it junk or whatever.
Yes, junk. You know. Yes. So unhealthy diet. Okay. Then sedentary living. You stay in one place and watch a 3-hour movie. You don't move, and after that one, maybe there is a part 1, part 2, part 3. And each of them is 3 hours. By the time you are done, you have stayed in one place for 9 hours. That's sedentary living. Of course, you wouldn't stay like that. You must find something to drink or something to chew. And quite often, those things you chew and you drink are not healthy in themselves. It may be a bottle of soft drink or a sugar-containing something, a snack that you are eating, or a fatty kind of snack that you are eating, or meat pie, or you are eating meat and you think it is enjoying life. So those are some of the known risk factors. Then women of childbearing age can be at risk of developing diabetes. Like I told you, there is diabetes in pregnancy, there is gestational diabetes. These are some of the risk factors. If you are from Africa, if you are from certain parts of the world like America or Latin America, you are at increased risk of developing diabetes. Now, if you have certain risk factors that we consider non-modifiable risk factor, for example, your age is increasing, you are getting 30, 40 and above, and you have family history. You can't do anything about your family history. You can't do anything about your age. Okay? So if you have those non-modifiable risk factors, it means that you should pay more attention to the modifiable risk factors. And which are these modifiable risk factors? They are the risk factors you are able to do something about. Take for instance, you can choose to eat healthy. You can choose not to get overweight, obese. You can choose to be physically active. Okay? So you will indulge in those activities that are within your ambits, the things that you can control. So those modifiable risk factors, you can work on them in trying to prevent yourself developing diabetes. So I have tried to answer your question in 2 ways. 1, to answer your question as to what are the risk factors for diabetes, and 2, to use that answer to propose that if you want to prevent the development of diabetes, you avoid those risk factors.
Now, does alcohol, cigarette, and does cigarette smoking contribute to diabetes?
Excellent question. These are part of what we call unhealthy diet, unhealthy living, unhealthy lifestyle. Okay.
So that's enjoyment, catching fun.
Yes, the way it seems to so many people who don't have sufficient knowledge as to the damage that cigarette smoking and alcohol does to their system. Note that if you take alcohol, some people say if you take it excessively, but I argue to say that how much is excessive and how much is little. So that which the mouth cannot eat, let the teeth not divide. I'm trying to be African now. I mean, so don't take, if it is possible, avoid alcohol. And I'm happy we are in Kano. It's a Sharia compliant environment where alcohol is forbidden. So avoid alcohol, avoid cigarette smoking. It might interest you to know that for each stick of cigarettes, there are over 100 different chemicals that damage the human body. And they cause all sorts of health problems, including diabetes, including heart problems, including vascular problems, and so on and so forth. So it's a dangerous combination when you bring alcohol, cigarette smoking together. You know, this is unhealthy lifestyle. They increase your risk for developing diabetes. Not only increase your risk for developing diabetes, they also increase the risk of developing diabetes-related complications. Like I mentioned earlier on, For the first time, some people present with complications of diabetes. And if they have this unhealthy lifestyle, unhealthy risk behaviors, they can have these problems.
Okay, now, Prof, what would you tell those people living with diabetes this period? That's talking about the Ramadan.
Okay. Let me say that it is a period that is associated with a lot of blessings. Blessings on the spiritual side, blessings on the physical side. And while I am not competent to talk about the spiritual aspect of it, because I will leave that to our Islamic clerics to do that very adequately, I could talk about the physical side. What are the physical benefits of observing a fast or Ramadan fast? It improves your well-being, your sense of well-being. It improves your overall health. It improves your blood pressure control. It improves your diabetes control. It improves your blood cholesterols. It makes you physically fit. These are some well-researched, evidence-based benefits derived from observing Ramadan fast. And so it is encouraged you fast. But like Hajia DJ has alluded to earlier on, who should fast? It's not everybody that has diabetes that should fast. So before a person with diabetes undertakes a fast, he should have a pre-Ramadan assessment. And that pre-Ramadan assessment, if possible, should take place weeks before the onset of Ramadan to determine your risk for going into Ramadan. And those risk categories can be low risk, moderate risk, high risk, very high risk. And so if you fall in the category of low risk, moderate risk, then you probably can fast. What constitutes low risk? What constitutes high risk? In brief, if your diabetes control is adequate several weeks before the onset of Ramadan, if you feel well and healthy, if you don't have comorbidities, meaning you don't have other chronic ailments like hypertension, cholesterol problems, heart problems, kidney problems, stroke, if you don't have them, then you can fast. You are considered to be low risk, even if you have diabetes. But if you are high risk, meaning you have diabetes, you have comorbidities, you have increased frequencies of in and out of hospital because of ailments, and your diabetes control is not good, you are not supposed to fast. And this can be carefully sorted out during the pre-Ramadan assessment when you see your doctor who is knowledgeable in the care of persons living with diabetes. And then while you observe the fast, should you have any problems during the course of the day, please, you can discontinue the fast immediately. Should you feel unwell, should you feel funny, you can't describe your symptoms, should you didn't have time to do the early morning foods, just go into the fast. No, for you that is living with diabetes, that is not allowed. And I think for our Muslim brothers and sisters, there is even a provision in the holy books that if you do not observe suhoor, it is also unacceptable. It has its own spiritual implications. So it is very important. The main problems with Ramadan fast or fasting for somebody with diabetes include abnormal blood sugar, whether it is too high or too low, hypoglycemia or hyperglycemia, the risk of dehydration, and note that we are in a hot tropical climate that is quite dehydrating at this time of the year. The risk of developing diabetes complications like diabetes ketoacidosis, and the risk of developing blood clots within the vessels as a result of intense dehydration. But all this will be sorted out, you'll be properly assessed by your doctor before you go into a fast. Finally, it is important that you keep close contact with your healthcare providers during the observance of Ramadan fast. So I will use this opportunity to appeal to colleagues in healthcare and in diabetes practice that please don't make yourselves inaccessible to your patients, because one phone call can save a life. Okay, one text message that you have ignored can make the difference between life and death. And we are in this profession as humanitarian I think it's the most humanitarian profession, and we are privileged to be in this profession to assist humanity. And so if you make yourself inaccessible, then you begin to play God. You begin to deny the populace the privileges that God Almighty has endowed upon you. So it is a time for all of us to join hands, put hands on deck, and make sure that our people, our parents, our brothers and sisters that are going to observe this spiritual exercise do it very well, deriving all the benefits that go with it, spiritual and physical, so that at the end of it all, we'll have every cause to celebrate.
Thank you so much, Professor Andrew. Let us come back to DJ. Now, hygiene is very important. I'd want you to advise those who even prepare the meals for those people living with diabetes in terms of hygiene. You see, vegetables, for instance, there are some parts that some people don't even know they have to clean properly before they even take it. So tell us more about the hygienic aspect of preparation of our meals.
Hygiene is very important. You know, all aspects of health. Hygiene is extremely important. We say washing of hands, washing of this, but what we need most is clean, potable water. We know that this area now, there are some places whereby they do not have water. They struggle a lot to get water. So, in advising our people about hygiene practices, and then because we are going to use a lot of vegetables, what advice I'll give is that let us use the vegetables that do not require a lot of water to clean them. Like instead of using a lot of leaves, especially lettuce and spinach, that require a lot of water to clean them, we can go for cabbage, we can go for leaf flower if they have, we can go for water leaf if they have, and then we can go for things like carrots, like cucumber, you know, instead of using the things that require a lot of water. And then when we are going to clean, please, vegetables should not be cut before washing. Leaves, all forms of vegetables, they should not be cut before washing. They should be washed properly before they are being cut. And then in washing them, you remove the leaves from the stalk as much as possible. You cut off the dirty part where there's a lot of sand. And then you find your container, you put whatever you have removed that you are going to use, you put into the container, and then you pour your clean water. Then you swash around, you swash your vegetables around. And then after, when the water has settled, you lift the vegetables out of the water so that all the dirt will be in that container. Then throw off the water, and then you wash the dish again, place your vegetables back, and then do the same thing until when they are clean. Even if you are going to use salt in washing, put the salt in the second water that you are going to use in washing the leaves or the vegetables, so that by the time you apply the third or the fourth water, the salt has been washed off. Because some people, they use a lot of salt, and then they put the salt at the end of the washing, so that by the time you lift the vegetables out of the water, the salt is still within. So you are increasing the salt content in that. We do not cut before washing. We wash, we drain off, and then we cut. Even in terms of fruits, like all forms of fruit, sometimes even if this oranges you buy, or this melon, or watermelon, or pawpaw, you see that the bark is dirty. Please wash them. Don't say you are just going to peel and eat, because the knife that you use in peeling off the dirt from the knife, from the bark, will go into the flesh again. So you wash before you cut. Always we wash before we cut. And the hand washing is very important. And then whatever we have cooked, please let us try what we cannot use at that time. Let us not put hands or spoon in. Let us just take the part that we eat. And then the other part, let us keep it properly. If we have fridge now, though what light is not readily available, electricity, let us keep it in such a way that it doesn't get spoiled before eating it, before cooking again, so that whatever you have prepared, because of the weather, the heat, it doesn't go bad. And then let us try to buy fresh foods from the market. Sometimes the ones that have already gotten maybe rotten, they are the cheapest one, they are the cheaper ones.
It's true.
So we go and get them. It's better we get the fresh one, the good one, than going for the ones that already has gone bad. We just end up maybe eating spoiled food.
Like the guys who speak pidgin, you say cheap article, the wrong belly.
No, but don't buy the cheap article. Buy the good one, no matter the quantity. It's better you buy the best, and then you have the best out of it. And then again, in terms of hygiene practices, let us cover our food properly. Even the place, the spoons that we are going to use, let us not keep them where these insects that come out at night to go and dance over, leave all things on them, and then we just put our food in and then we take. So as much as possible, let us try to practice hygiene.
Okay, as we wind up this edition of the program, I'd like to come back to the endocrinologist, Professor Loko. Now, in spite of the fact that many people who are living with flouting of the necessary cautions. Now, if these people present themselves for checkup or treatment within the period, how is this being handled? So we're talking about treatment now.
Yeah, thank you very much. We encourage that as much as possible during observance of Ramadan fasting, somebody with diabetes should do more frequent monitoring of his blood glucose so that the fluctuations can be detected very easily and then you can take measures. There are certain things you can do even before you reach a healthcare facility. For example, you feel your blood glucose is not steady, you have to stop fasting. You feel unwell, you have to stop fasting, and so on. But once you get to the health facility, it is important, ab initio, to announce to the healthcare practitioners that you are an individual living with diabetes, so they know what specific areas to address. And then you will be asked a number of questions during the interaction with the medical practitioner, and that will give an idea of what the problem is. Should it be a sudden loss of consciousness or a life-threatening emergency that has happened, God forbid, stroke, heart attack, or kidney failure, that too will be addressed as appropriate. The main aspect of it is that we should not hesitate to go to the hospital. This is a holy Caesar salad, then we can go to the hospital. Please don't delay. Don't keep your health problems with you and say because it is Azumi, I will not go to the hospital, because you are not a medical personnel, and that which you ignore, that you take for granted, can become something very dangerous at the end of the day. So it is encouraged that people are in close contact with their healthcare practitioners. And like I have appealed, I will appeal again and again, that healthcare practitioners at this time should please make themselves accessible to their patients. I know let me speak for doctors now. People accuse us a lot that we don't take phone calls, we don't reply text messages, we are difficult to access. Please, it is true. And it is because of the nature of our work. We are usually multitasking and we are overburdened by a lot of work. But it's an occasion for us to please give back to society all the cooperation that and understanding that we have enjoyed from them. So it is a time to please pick the call if your patient is calling you. It's a time to address to their needs. Of course, I know that if I have talked like this, some patients can take us for granted. For instance, somebody calling me at 12 midnight to ask me whether I can eat granuts. I mean, this is those are one-off kind of things. But generally speaking, I encourage that people should seek medical advice at the earliest while they are observing Ramadan fast. Don't delay. Don't say I will not go to the hospital simply because it is fasting season.
All right, that is the size of the program Health Hour on Rama Television this day. We want to give thanks to DJ Sule Kabara, private consultant dietitian. Thank you so much.
Thank you so much.
And Professor Andrew Uloko, Professor of Medicine, BUK, Consultant Endocrinologist, Aminu Kano Teaching Hospital, past National Vice President, Diabetes Association of Nigeria. We say thank you.
Thank you very much.
Can I say something?
Okay, quickly.
Okay, quickly, please.